Hi, this is Dr. Chu. I'm here at CES 2010. I'm here with Ralph Mendoza, who's from Stora Enso, a packaging company. And this is a neat little blister pack device that has some other very neat features. And I'm going to have Ralph talk about them. Ralph, tell us a little bit about your product.
Thank you, Dr. Chu. What we actually have here is a blister pack geared for persistence and adherence for better patient outcomes. And what we're actually designing it to do, and what it's doing, it's recording timestamps in terms of date and time, and it actually can be customized to do auditory reminders, or basically just let a clinician or somebody who's involved in the program know when products have or have not been dispensed. So it acts as Big Brother in order to really work with the patient and coach them through their therapy.
Now, so, David, when you say record, what do you mean exactly? How is it recording that information from the patient?
Sure. Let me demonstrate it. What we'll actually do is we'll dispense a dose, and how the technology works is we are actually embedding printed carbon-based inks inside of the paperboard, and what happens is when the dose is dispensed, we can actually I'll put it on the side there, we're seeing a little black film in there. Let me peel it back. What we're actually doing is we're breaking this conductive trace. The trace actually goes back to a microchip that's embedded in the paperboard.
There's a microchip in there.
There is a microchip in this area.
But not visible, though.
Not visible. It's embedded, so it's not visible to the patient or consumer who's actually
So it's almost like those electronic greeting cards you can sometimes get that play music when you open them up. Similarly, there's a chip and battery embedded or something like that.
Somewhat. I mean, the battery life in itself can be programmed to, let's say, last up to about 18 months, a little bit longer, a little bit less time, actually, depending on the use case of the card that we're designing, or product or pill pack that we're designing.
Now, David, in addition to determining or documenting when a patient takes a dose of medicine, does your technology provide a way for asking them questions along with when they take their dose, such as how they're feeling or side effects or things like that?
Exactly. We understand that patients today are diagnosed with several indications and may actually be required to ask questions in terms of if they are taking other doses or if they simply eaten before taking a dose. And this is really important information that usually a primary care physician would need to know, so the information can be tailored and incorporated into the package.
How does the patient record that information?
Typically, a lot of that information is already
it's printed on the blister
It's
pack.
already pre-printed, so it's been predetermined.
Can you demonstrate for us how a patient would use the blister pack to record?
We would actually start the action by putting the start button there, and I'll put it a little bit closer so you could probably hear there was a beeping there. It actually lets the patient know that it's recording, and then the first question would be, do you eat before taking your medication, yes or no? Today I haven't, so I'll press no. And then the next following question would actually be press your finger to the scale to indicate your state of mind. I'm feeling great today, so I'm going to say okay. Now all of this information is now registered back to the chip, along with the information in terms of the doses which have or have not been dispensed, so that we can actually then go back and scan the card, either using a wired type of device such as a USB reader or a wireless device using near field communication.
David, I'm sorry, Ralph, I called you David. Ralph, tell us how do you envision physicians using this technology? Would it be community physicians practicing, or would it be more for research purposes?
Well, where we actually see it is probably more with primary physician cares and healthcare organizations, where they're looking to reduce the overall cost to spend per patient. So let's say any indication for type 2 diabetes, where a patient might not go into a doctor's office but for every, let's say, 3 months, and then monitor their activity. What this will actually do is do real-time intervention between the patient and, let's say, the individual who's diagnosed with type 2 diabetes. And what that will allow is real-time intervention and coaching along the way, so that there is not further incurred cost, and one could actually coach the patient in saying, we need a little bit more exercise, maybe there's something that we're reading here in terms of your systemic level of your blood pressure or sugar levels, all which will help initially, obviously through the taking of your meds, but through all the other devices and the interaction between patient and physician.
Now, David, I'm going to ask you, A hypothetical question.
Okay.
And one thing that we're seeing here is a lot of e-readers and the use of e-paper. Now, I know the cost is prohibitive today, but perhaps 10 years down the road, if we were able to have very inexpensive e-paper type displays that you could put into your blister pack, would that be something that could give patients more real-time feedback? For instance, if they skipped a dose, and it would tell them, for instance, how to respond to that.
It possibly could.
And are you thinking about incorporating those future forward-thinking type of technologies into your products?
I think there's always the possibility to do so. I think some of the limiting challenges that there is right now is regulatory requirements. We always have to be concerned with regards to HIPAA, the Patient Privacy Acts, and what information we can put out there, what information can be shared back. So the technology is already there. It's proven. It's available today. The only challenge is, I would say moving forward is how that technology will be perceived by the patient, and if there are challenges from a privacy standpoint.
One last question, Ralph. If a physician is interested in learning more about your product, how can they get more information?
For more information, you can go to www.storaenso.com with a /pharma, and in there you'll find more information under Pharma DDSI and Pharma Memorial Card. All the information will be there.
Ralph, thank you so much.
Thank you, Doctor.